back to our channel. Your health are concerned. My name is Patience from Asset Pharmacy. Still on World Immunization Week, Pharmacist Charity and Eunice are here to enlighten us on polio and MMR. What I mean by MMR is measles, mumps, and rubella. Stay tuned and enjoy this section. Pharmacist Charity, please give us more details on polio.
Poliomyelitis, commonly referred to as polio, is a life-threatening and disabling disease caused by the polio virus. This polio virus actually affects the nervous system, infecting the spinal cord especially, and causing irreversible paralysis. Polio virus is a virus that could actually be prevented by vaccine, but note, there is no treatment to polio. Polio can be gotten from person to person, that's from a contaminated person to another through fecal-oral route. That is, when an healthy person comes in contact with the feces of an infected person to the mouth, then the person could actually be infected with polio. You could also get contaminated by having contact with contaminated food and water. You should note that children under 5 years of age are at high risk of contracting this polio.
Since polio has no cure, fam, what are the vaccines for polio?
There are actually two types of polio vaccines. The first one, known as the Ipv, the full name is Inactivated Polio Vaccine, and the second one is the OPV, which is the oral polio vaccine. But in this video, I will really be talking about the Ipv because the OPV has been discontinued because of high cases of vaccine-derived polio, which affected the US. So the Ipv is what they've actually been using over there, that's in more developed countries, to have a polio-free environment. So now these inactivated polio vaccines are actually recommended to all children. CPC recommended, and also WHO has recommended that all children should have taken these vaccines starting from 2 months. The Ipv, inactivated polio vaccine, inactivated, that is, these polio vaccines are actually killed. So there's no risk of vaccine-derived polio, unlike the oral polio vaccine, which are life-attenuated vaccines. That is, the vaccines are actually alive, but they are weakened. So in some cases, when people are being administered the oral polio vaccine, especially with someone who is already healed or has a weak immune system, could actually come down with polio itself.
At what age should polio vaccines be administered?
Thank you. So polio vaccines, both the Ipv and the OPV, has to be administered from infant. The Ipv is being administered from 2 months. The first dose is given at 2 months. Then the second dose is given at 4 months. The third dose is administered 6 to 18 months of the child's life. And meanwhile, the fourth dose is administered 4 to 6 years of the child's life. So note that Ipv is being administered either intramuscularly or intradermally. OPV, on the other hand, is giving 0.5 ml to infants at 6 weeks of age. That's when the first dose is usually given. Adults can also be administered the OPV, and they are given 0.5 ml initially. The second dose is followed 8 weeks after the first dose, and the third dose is followed 8 to 12 months after the second dose. In a case where a child is about to travel to a country where polio is epidemic, the child should be given his complete routine course before traveling to this country. Or even if the child is unable to take the complete dosing before traveling, an accelerated dose can be given to this child. First dose is administered to a child 6 weeks and older. The second dose is given 4 or more weeks after the first dose. The third dose is given 4 or more weeks after the second dose. And there should be a last dose given when the child is 4 years old. But if the child is unable to complete this accelerated dosing, the child could actually travel to this epidemic country and come back to fulfill or complete its course. So note that adults, there are 3 groups of adults who are at risk of getting polio. Health workers, those who work in laboratory and handle these fecal samples, and also people who have those that are contaminated with this virus living around them. They should also go for this vaccine or speak to their healthcare provider and book vaccinations so that they can help prevent this polio from spreading.
Please, fam, tell us other keynotes.
Okay, polio, remember I mentioned earlier, is preventable by vaccines, but it has no cure. It can only be managed by some treatments, painkillers, and hydration in patients who suffer disease condition. But another thing we should note is adults who in the past, they may not need this vaccine because when they were younger, they've actually taken these vaccines. But if you are not too sure about your vaccination when you were younger, you could actually take an IPV booster dosing. And this IPV booster dosing, its immunity lasts for a long time, although it hasn't been confirmed for how long it may last. So if you've actually taken incompleted doses of these vaccines in the past, you should complete your 4 dosing recommended by WHO. No matter how long it has taken, just ensure you complete this polio vaccine dosing. Also note that people who may not take these vaccines are those who have extreme allergy conditions after the first dosing, and also those who are ill. They are recommended to avoid the oral polio vaccine so as to avoid the vaccine-derived polio. Finally, the side effects you may experience from administration of IPV is soreness to the injection site, that's intramuscular, either the arm or the leg. And this soreness may be prolonged. So you could use paracetamol to take care of the soreness at the injection site, or you could make use of warm cloth inside the warm water and just press on the area of administration. Then if you want to book this vaccine, you could visit any primary health care center around you and they could tell you more information about administration of these vaccines. And if you still want more information concerning polio, you can reach out to us on our webpage www.assetpharmacy.com. Thank you.
Eunice, what are the peculiarities of these vaccines and virus since they are being administered as well?
Well, let me start with measles and mumps. Both are caused by paramyxovirus, and that means that they are RNA viruses and they transmit respiratory diseases. And their mode of transmission is basically by airborne droplets. For mumps is a virus that is transmitted basically through the salivary exchange. If through speaking or coughing, if the salivary droplets come in contact with someone else, then the person gets contaminated or gets infected with mumps. And the basic symptom of mumps is painful swelling of the salivary glands, and this is manifested in form of a visible swelling on one or both parts of the cheek where the salivary gland lies. Then another peculiarity with this virus is that it takes 2 to 3 weeks for symptoms to manifest. And basically what we see, as I mentioned earlier, is that swelling on the cheek. Then there are complications associated with this virus, the mumps virus basically. And this comes in the form of meningitis, encephalitis, and even hearing loss, because somehow it affects the hearing side. Then for the measles is kind of different from the mumps virus because it basically has 2 stages of manifestation. One, it manifests as fever, and then it manifests as cough, then an running nose. This is also known as coryza, or red watery eyes, also known as conjunctivitis. And this occurs between 7 to 14 days after the virus has been contacted. Then between 2 to 5 days after these symptoms manifest, the person also manifests visible signs of rashes. These rashes are reddish, and in most cases they are clustered. They come in form of clusters. So you see elevated red rashes that sometimes occur in form of clusters. That's a sign of measles. And however, 2 to 3 days before the onset of the measles rash, we have what we call copic rash, and these are white patches in the mouth. These occur in the mouth. So you see white patches, white light rashes in the mouth. That's the sign of measles. What are the complications of measles? Well, the complications of measles include encephalitis, pneumonia, and in a very severe case, which usually occurs 7 to 10 years even after the development of this measles, you see that the patient might come down with what we call subacute sclerosing panencephalitis, and this is characterized by convulsion and other cerebral malformations. So it is very important that we get vaccinated against measles and mumps. Now we come to rubella. Rubella is somehow different from measles and mumps because while measles and mumps are caused by RNA viruses, and rubella is caused by a DNA virus. And rubella is also known as macular rash or German measles. Now, another peculiar thing with this rubella is that unlike measles, it causes low-grade fever, and also it causes conjunctivitis, quite alright, but it also causes adenopathy, where you see that the lymph nodes become inflamed. So rubella can be transmitted during the asymptomatic periods. That is like 7 days before the onset of the rash and can extend to 15 days after the disappearance of the rash. And still, the complications of rubella is not as much as we see with measles and mumps. The complications are usually very rare, but in cases where they occur, encephalopathy is noticed. Complications that occur in rubella is not as severe as we have with measles, especially. Yes, complications occur, but in very rare cases. Now you come to see encephalopathy being manifested in uninfected patients. But with pregnant women, the complication is much because it can result in stillbirth, it can result in abortion, and it can also cause congenital defects in the fetus. So it is very important to still get vaccinated. Now, measles, mumps, and rubella vaccine is given as a 3-in-1 combination vaccine administered at once. The essence of the 3-in-1 combination vaccination is to reduce the side effects associated with administration of a vaccine, and which basically involves pain at the injection site. It is more convenient to administer. Now we come to the vaccination schedule. The measles, mumps, and rubella vaccine is administered between 12 to 15 months of age. That is when the first dose is usually administered. But in exceptional cases, like during travel or during a measles outbreak, the vaccine can be administered to a child as early as 6 months. But in such cases where administration is done at 6 months, it is usually advisable that 2 more doses be given, starting from the child's first birthday. Now the second dose is administered between 4 to 6 years of the child's life. What are the exceptions to the use of these vaccines? Or in what circumstances, under which circumstances will the administration of measles, mumps, and rubella vaccine be contraindicated? One of it is when a patient has cancer. So in cases where we have something like leukemia, cancer of the blood, it is usually advised that the vaccine not be administered to such patients. Then we have immunodeficient patients that are immunodeficient, like their immune system is not properly functioning. In such cases, it is usually not advisable to administer this vaccine. And the reason for this is because the vaccine it comes in the form of a live attenuated vaccine. Like the virus is still alive, but it is inactivated. Like it is made not to be very, very viable. So if you are not immunoactive, if your immune system is not functioning properly, anything can happen that is such that you might not be able to combat the effects associated with taking this vaccine. And it might result in infection rather than prevention of the disease condition. Then in another case where we have immunosuppression therapy, like when a patient is being administered corticosteroid or other steroids, it's usually also not advisable to administer the measles, mumps, and rubella vaccine. For more information on measles, mumps, and rubella virus and vaccine, you can reach out to us on www.ancetpharmacy.com.
Thank you so much for watching this section. I have learned so much today, and I hope you did too. Now you know the importance of this vaccine. Please do not deprive your loved ones from being vaccinated. You can click the link below to drop your message. Please don't forget to like, share, comment, and also subscribe to our YouTube channel.
Visit our webpage for more tips and blog at www.assetpharmacy.com, or you could reach out to us on WhatsApp on 090-3455-3795.
See you on our next video when we'll be concluding on vaccines. I remain Patience from Asset Pharmacy. Bye.
Bye.